of that is called a pyogenic granuloma. Essentially, the nail is digging into the skin and the skin is trying to protect itself of that. Hey everybody, it's Dr. Nicole Freels. I have a really juicy ingrown toenail for you. I don't know if juicy is the right word, but it is. Kind of take a peek with me. How long did you say this had been here?
A few weeks.
A few weeks. It's crazy to me how quick that this can turn around. He's already been on an antibiotic called doxycycline for 5 days. We're not getting the results that we want, so we're changing that up to Bactrim. So if you can just relax your foot for me, and then I'm going to test it, make sure you don't feel anything. Any pain in here?
No pain.
Good. How about over here?
No pain.
Perfect. And we were talking before that typically he needs a little bit more of anesthetic because he is of Irish descent. It is a thing. So is that happening whenever you have dental work done?
Yes.
Okay, just look at that. All of that is called a pyogenic granuloma. Essentially, the nail is digging into the skin and the skin is trying to protect itself. Yeah, it's really loose. There's not a lot of attachment. So the granuloma is trying to protect it from the skin and from it piercing. This just tells me it's been going on for quite some time. Nice crunch of the nippers, huh? All right. So the biggest thing with this is to note how quickly that these can turn around. And we already looked at his x-rays. There is no bone infection, but if you've had a recurrent ingrown such as this, look at that. That's a big piece. That's a really big piece. Tanya, we might have to do some silver nitrate for his granuloma, if you don't mind to have a couple sticks ready. Rotate that out. Boom. Wow. All right, this is gonna feel so much better. Get that little piece of skin because you know I'm OCD and it has to be perfect. Okay. Get this. So these guys like to bleed. They're highly vascular. So when I take the tourniquet off, we always expect it to bleed a little bit more because of the granuloma. So yeah, let's do the granuloma first, and then I will do, get that little piece right there too. Then we'll do the chemical so the ingrown doesn't come back. Typically there's about a 5% chance it can return. However, with the presence of an infection, that rate increases. So we're just gonna get that silver nitrate right here. And so what this is gonna do is help retract the, thank you ma'am, the skin and this little tuft of flesh so it can go back to its home. You doing okay up there?
Doing great.
All right, please feel free if you have any questions. I'm all ears. Okay, so this is the chemical. Good. You may see a little dark discoloration on the nail itself from the chemical. It will grow out. We do have it's an oil if that happens, that has lactic acid in it it'll lift out any discolorations, yellowing, any white dots on there. Thank you, ma'am. It's called Repair. Do you typically leave your nail this long?
No.
Okay, good. I'm gonna trim it for you because I've seen patients that have longer toenails are prone to getting ingrown toenails. Also, on the opposite end of that, shorter nails can cause ingrowns. I see that with kids picking and peeling their nails. Ooh. Okay, last one. Almost there. After this sits for a few seconds, we'll get it cleaned up and then wrapped up. It already looks better.
Feels a lot better.
It feels a lot better. You can't feel anything though. Yeah, that's too funny. All right, and then you're gonna come back with us in a couple weeks, make sure everything is healed. Please, if you have any redness that extends past, especially the joint here, that I want you to go to the emergency room, call us, because we don't want that infection to continue to progress. And I'll just get the little bit of this nail. Make it look nice and pretty. But if you need us before that, just please call. know no one likes how I hold the nippers, but you wouldn't believe how many comments I get on how I hold the nippers on YouTube. Okay, let's get you wrapped up. Okay. All right. Torture is over. You did great. Everybody, I hope you learned something today. Please feel free, if any questions, drop it below. Don't forget, follow the channel, and I'll see you next time. Awesome. Thanks, guys.